My name is Kelly Danis, and I am the Nutrition Director for UPMC Presbyterian Shadyside. UPMC is a world-renowned facility with over 30 hospitals and 80,000 employees. We know based on the evidence that 30 to 60% of our patients coming into any hospital door across the country are either malnourished or at high risk for malnutrition. Throughout my career as a dietitian, that's what we do, identify malnutrition and try to bring recognition to that to the interdisciplinary team. And I think after many years, there was finally just enough data and enough evidence that everyone else finally figured it out and understood the importance and the impact that it can have in improving patient outcomes. UPMC is very forward-thinking and looking for more opportunities to advance care. Taking part in MQii fit with the philosophy, and it was a very easy sell to move forward with the initiative.
The biggest thing that I saw is our dietitians took the time to come forward and meet with me and educate me on malnutrition. When they came, they were so surprised because they thought they were asking for a lot and the funding was so minimal, but yet the benefit was so huge. And it was an easy decision from my standpoint.
UPMC is always looking for ways that we can improve the care of our patients. We're absolutely a center of excellence, and when approached with these measures, it was an easy decision for us to partner with the Academy so that we can continue to improve the care of our patients.
The MQii, which is the Malnutrition Quality Improvement Initiative, has established electronic quality measures that will help us identify how well we are screening, assessing, diagnosing, and implementing plans of care, which are important to do during that short hospital stay. The importance of capturing and identifying that malnutrition during the inpatient stay is even more elevated, knowing that once they're out there in the community, those opportunities do not exist. Because we were already working on a few initiatives surrounding malnutrition, we were able to use the MQii to take those initiatives to the next step. Pulling the interdisciplinary team together is the most impactful piece of all of this. Every position has its role because malnutrition needs to be treated by everybody.
When I was asked to join the MQii team, it was a simple decision. This is a very important issue that we need to take care of in this country.
The dietitian is really the most important role in identification of malnutrition. They're the expert, and they're the ones that need to identify it and bring it to the attention of the interdisciplinary team so that it can be treated. One of the gaps that we identified was that communication between the dietitian and physician to assure the dietitian was sending a very clear message to the physician for them to fully recognize the level of malnutrition that was present.
This quality improvement project got all the players in the room to really get everything together, get the data, see what we were missing, see where the gaps were, give us structure to addressing this problem. And we're seeing that here at UPMC with this increased collaboration between the physician and with dietitians.
I think the team is one of our best performing teams we have. The collaboration between the physicians and their commitment and the dietitians and administrative, it's all about them working together for the end goal of the patient, and malnutrition has just come to the forefront on our standpoint of why it's so important.
Participating in an initiative such as MQii just opens so many doors to look at your process, look at your treatment of patients, the identification of malnutrition, and really elevate it to the next level. With a large institution such as we are, if it can be done here, I think you'll find that you could get as much support at your own facility. You probably have more people already engaged and fully understanding the importance that you might not even know of yet until you ask.
It has improved our patient care. It has improved the quality of care that we provide to our patients.
It has really opened the door even more for the dietitian's importance within the healthcare team to be highlighted. Anybody can implement MQii into their system. It is work up front, but it is so valuable and so worthwhile in the end that yes, anybody can do it.